Well, thank you all for attending today's session. This is now our third session for the 2021 North Country Leadership Summit, Emerging from a Year of Change, an opportunity to rebuild and reimagine. This conference has been brought to you by Adirondack Health Institute and Fort Drum Regional Health Planning Organization. So just a quick thank you to our sponsors. Without these sponsors, our event would not take place. So we're thankful for their continued support and especially their support this year, hopefully many years to come. Few housekeeping items. We're going to ask that everyone please put all their questions and comments in the chat, and the staff will ensure that the questions are answered during the Q&A session. We have at least 4 staff members of the summit planning team on, so we will all make sure that if any questions or concerns come up, please let us know and we'll take care of those. We are asking that you remain muted and that your video is off for the presentation so that we can ensure the best broadband connectivity possible. And all presentations today, including this one, will be recorded and archived on the North Country Leadership Summit webpage by October 1st. So with that, I'm going to turn it over to Josh. Josh, if you want to go ahead and share, and then I'll hop off camera for you.
Great, thank you, Sarah. So I'm going to kick it off today. It looks like my co-presenter is having some technical difficulties, so I'm going to do my best to discuss some of our initiatives that we're working on with AHI and the Adirondack Food System Network, and also focus on some of the work we're doing together. So for a little bit of background, my name is Josh Stephani. I'm the Community Health Coordinator for Comfort Food Community. I'm based in Washington County. We collectively work in Washington, Warren, and Saratoga County, so on the southern end of the Adirondack region. We're doing a variety of different things, from emergency food assistance to community health programs, and some of those work tying food insecurity and health. So the important conversations we're having around health and what that means for AHI in the region also dovetails very nicely with some of the work we are doing here in the Adirondack region. And it looks like my co-presenter is hopping on, so just give her a minute to appear. So if we can add her, Sarah, as a co-host.
Yep, I'm doing it right now.
Great. So apologies, everyone. Probably all calling in from different areas.
Brittany, are you able to unmute and pop your video on? I tried to give you that. Oh, that means yes.
Yes, I had the hardest time getting into the meeting. Zoom kept crashing, so I'm so sorry, but it seems as though things are working now.
Not a problem. So I just introduced myself and kind of paused. So Brittany, I don't know if you want to take it from there and talk a little about your work, and I can control the PowerPoint from here, if that works for you.
Yes, that sounds great. Thank you so much, Josh. So hi, everyone. I'm Brittany Christenson. I'm the Executive Director of AdkAction, and I'm also currently serving as the co-chair of the Adirondack Food Systems Network. So next slide, please. All right, so what is the Adirondack Food Systems Network? Why are food systems important? Well, the food that we eat can have a negative or positive impact on the environment, on our bodies, and on our communities. Food systems ensure food security, improve nutrition, and can support livable wages for those working in agriculture, food distribution, and waste management, for example. Food's a basic human right, and food supply chains both affect and are affected by all aspects of life, as you can see in this diagram. Food is very personal. Globally, climate variability and change are harming human health. They're affecting the most vulnerable, and health risks associated with these changes are projected to increase with additional global warming. So I think that that's one of the reasons that it's so important right now that we look into more resilient local food systems. Our ability to shorten supply chains and to plan for climate change and being able to feed ourselves as a region is increasingly recognized as an urgent need. I also want to say that health systems will continue to need to manage increases in the burden of climate sensitive health outcomes. So proactive and effective actions by health systems partners in collaboration with food systems partners can really help to increase resilience in our region. All right, next slide, please. So in the US, food systems are important to consider alongside trends in human health. Since 1958, diabetes rates in adults have increased from 1% to 7%, from 3 million people in 1958 to 23 million in 2015. So over the same time period, obesity rates have also increased from 10% to 43%. I think it's interesting to consider that our shift from localized food systems to a globalized food system has lined up pretty clearly with this same timeline of the increase in obesity. Maybe a big part of that is the highly processed food that's really able to be transported in a global system. So next slide, please. All right, so just a high-level overview of a local food system and some of the components. You can see that this is a loop. The food, I apologize if there's some background noise. So the food that we eat is grown and harvested on farms, and it's packed and then transported to retailers and to consumers, and then it's consumed and hopefully composted. And then that composted waste re-enters the food system as nutrient that we add to our soil through compost. So that's an ideal local food system where all the pieces are connected in a loop. Next slide, please. All right, so I mentioned a little bit earlier that there has been this shift from localized food systems to more global. And now what we're saying is, let's go back again to the local food system. There's some great bumper stickers you can find that say, try local food, or as your grandparents called it, food. And I just love that because this is not something new. This is a return to our roots in many ways. So I mentioned the obesity statistic earlier and the fact that the timeline was pretty similar with changes in food systems. So at the same time that we were seeing these huge rises in obesity, our US food system went through massive changes as well. And you can trace that back to World War II, where regionalized food systems in the late 1950s started to trend towards a massive globalized food system that we have today. And I must say that the globalized food system does have many benefits. It's incredibly efficient to transport and very cheap to buy and transport food around the world, especially to urban populations using this food system. So with an increase in population growth and with the massive trade that we see across the globe, there certainly have been benefits. And I think chief among those benefits for the globalized food system have been profits. The food system has become very profitable because when you have food that's highly processed and packaged, it doesn't go bad as quickly. You can ship it around and make every penny possible off of it. So I think a lot lends back to profits. But what we need to focus on, what we need to recenter on is human health, community health, soil health, and climate resilience. Next slide, please. So when COVID-19 hit, some of the weaknesses in our globalized food system became very apparent almost overnight. Despite an interest and awareness of the importance of food systems in the last several decades, we were shocked and concerned by the empty shelves on our grocery stores in our own communities. This happened right here in the Adirondacks. It didn't happen right away, but within the first few weeks and months of the COVID outbreak in 2020, we started to see that certain products would be out of stock or very difficult to purchase. We started to see purchasing limits, like for frozen chicken, I remember seeing limit 1 per customer. The food system became a news story nearly overnight with COVID-19. So in this area specifically, we don't have a huge, when I say this area, I'm referring to the Southern Adirondacks for this particular talk, but more broadly to the 9-county region that AHI manages and that we look at as part of the Adirondack Food Systems Network. So maybe we didn't see quite as long of lines as you may have seen in Dallas or Southern California on the news, but we saw a lot of difficulties and friction points in our own emergency food distribution system, in our own availability of products at grocery stores. And many of us that work in food systems related work in the area started holding cross-sector meetings. This was starting right around end of March 2020. So the cross-sector meetings began among organizations and individuals, service providers, and healthcare workers. And we met every other week for about 6 months and talked about how things were going, made connections between food pantries that could share resources. My organization, AdkAction, partnered with the Hub on the Hill, and we launched the Emergency Food Packages Project, which you see in the photo here. But these calls were incredibly insightful, and we all had a very urgent need to rally around. And the conversations grew into this idea that we needed more regional collaboration on a regular basis to coordinate and catalyze and strengthen our food system and truly build back better. So that was really the origin story of the Adirondack Food System Network. I should say that thank you. Just a note on the picture, I was just going to say that that's Jory Weekend from the Hub on the Hill in Essex, New York, delivering our emergency food packages to families in need. And we delivered over 65,000 meals over the course of the first 7 months of the pandemic. Next slide, please. All right, so here is the mission statement for the Adirondack Food System Network, or actually the definition rather. So it's a collaboration of multiple organizations working together as equal partners to better understand systems-wide issues, identify gaps and realistic solutions, and help strengthen and promote a more resilient regional food system. So the Adirondack Food System Network is covering the 9-county region, as I mentioned before. And the 9 counties are St. Lawrence, Franklin, Clinton, Hamilton, Essex, Warren, Fulton, Saratoga, and Washington counties. Next slide, please. These are our vision and mission statements. I'm going to read the mission. I'll let you read the vision on your own. So our mission is to advance innovative solutions through lasting collaborations that strengthen and improve our regional food system for individuals, the environment, and the economy. So that line there, individuals, the environment, and the economy, that's similar to the triple bottom line that a lot of our farmers will talk about. So it's not just about profits, but it's also about the health of humans and the environment. So that's what we're trying to do. We're trying to really get folks to work together. We're trying to break out of our silos. We're trying to connect food systems partners and farmers to healthcare partners and find ways to feed everyone in an equitable fashion across the entire food system network. We're looking to support the various sectors, of which there are 5 in our local food system, and ultimately become much more ready and resilient in time for the next disaster. So if you can go on to the next slide, please. This is a preview of the structure for the network. So we are run by a steering committee. We have a steering committee now with founding members, and we have 2 vacancies at the moment. And our steering committee meets 10 times a year. And then we also have our general membership. And I would encourage all of you, if you're not already a part of the general membership, please go ahead and join. I can put a link to join in the chat right now. I actually have that tab up and copied. So I'll pop that in just a second. But the general members can participate by contributing time and talents to advance the vision, mission, and values of the network through our working groups. So without being on the steering committee, being elected to the steering committee, you can participate on the working groups, which are listed here. We've got 5 working groups: production, processing, distribution, consumption, and food waste management. And so if you want to be involved in some capacity, each one of our work groups has their own schedule for meetings, but most are aiming for monthly. So our general members also serve to promote and support the work of the network in target communities. So you can be our boots on the ground as a general member. But at the same time, you don't hold responsibility for the network's activities unless desired. So it's a great way to get involved. What we're doing right now at this stage in our development is getting all of the working groups off the ground. So 3 of the work groups are currently active. The production and consumption, and distribution are the 3 active work groups so far. And we are really excited to get the food waste working group up and running soon as well, because there's a new composting law that goes into effect next year in January for large scale food waste producers, that they will need to start composting food scraps next year. So that's an important one. AdkAction has a Compost for Good project, and we're looking to get our team from Compost for Good involved. If any of you are interested in food waste or work in food waste management, please do reach out, because that's another big one. But essentially the idea here is that we will have these working groups that between the steering committee meetings get together and talk about some of the integral issues within their focus, and bring those issues back to the steering committee so that we can try to ultimately strengthen every aspect of the region's food systems. Next slide, please. All right, this one just goes a little bit more in depth into the work groups and what elements are included in each work group. So when we talk about production, we're talking about land, access to land, land conservation, farmland conservation. We're talking about labor. That could also include housing. Housing is a huge issue across our region right now, but farm workers need housing. They need fair pay as well. Soil, water, equipment, energy, infrastructure, everything that goes into producing our foods within the region. Processing is focused on taking those things that have been grown, produced, or raised on the farms and turning them into value-added products, for example, cleaning and packaging, that sort of thing. And then, of course, distribution. So there's a growing movement for direct-to-consumer distribution in our area. So things like CSAs or farms that have farm stands where you can go purchase right outside. And then we can also look at examples like the Hub on the Hill, where the food is actually distributed out to different wholesale contacts and even door to door through online sales. After distribution comes consumption. So that's working with grocers, institutions, restaurants, food pantries, and consumers to get the food to make sure that once the food is available for people to purchase, that they know what their options are for local purchasing, that they have the support they need, the nutrition education they need to actually use the food and benefit from it. And finally, after consumption comes food waste. So that's our composting. Again, there are some innovative ways to create energy from food waste, which is really exciting. And of course, that compost goes back into the soil. So hopefully, if any of you are interested in getting involved in a work group, that gives you a bit of a better sense of which work group might be a good fit for you based on your interests. All right, next slide, please. Thank you. So one of the first steps that this network will be undertaking is trying to understand more about the food systems issues from a database perspective. But we strongly suspect that there will be immediate opportunities to take a look at 2 known issues. So just to bring this home, to what's important about getting together as a food system and looking at these issues. 2 of the biggest issues we've already identified are net farm income, and that is the cash that farmers take home after their expenses and debts have been paid. So it's the cash they can save for retirement, reinvest in their aging infrastructure, or to pay themselves. Not sure if you know this, but a lot of the farmers in our region don't pay themselves at all. The average net farm income in most counties in the region is below the national average of $43,000 per farm per year. And so that's a family, right? Oftentimes that's a husband and a wife together that are making less than $43,000 per farm per year. And a lot of that might also even be reinvested in the farm. So at the end of the day, there's very little going back in the farmer's pocket. As you can see in this chart here, some of the farm incomes are even negative, and many are extremely limited. So can you imagine being a farmer in Essex County that works 60 hours a week year round and only has $1,300 in cash to show for it? This is not acceptable. At the same time that our farmers are struggling to make a livable wage, food insecurity rates in our region are expected to increase 3 to 4% percentage points in 2020. So some early data is coming back on that. But it's hard to say at this moment. Usually the statistics on food insecurity lag by about 2 years. So we can try to address two challenges at the same time by increasing farmer sales and maybe their margins too, while at the same time feeding people in need. But the only way that we can try to address these issues in tandem is if we break out of our silos and we work together as a network. For example, one of the programs that's started up since COVID-19 as an outgrowth of the emergency food packages is fair food pricing, which subsidizes the cost of locally purchased food for low-income families. The idea being that farmers can increase their sales by having access to a portion of the population that might not usually be able to afford to buy from them. And at the same time, with so many gaps in our food system where people are unable to get to the grocery store because of lack of transportation or can't afford local food or whatever the barriers may be, they're able to receive a subsidy and even home delivery of the local food to fill that gap. All right, on to the next slide, please. I think did we skip one in between? Well, there we go. I wanted to point you all to the website. AHI is the backbone of the Adirondack Food Systems Network, and they have been such a blessing to all of us because AHI has an incredible reputation, a great data team, and just all around a great convening partner for our region. And so when we launched the Food Systems Network, AHI stepped up as the backbone and helped us form the structure of the network. And the first project that the network took on was the creation of this story map. So on the website, which I'm going to just pop the link in the chat so you can go there yourself right now as well. There we go. You can see that there are multiple tabs, so you can check out the Food System Network, what it's all about, read the press release from when we first started. You can also look at the food insecurity tab, which is the one that's pulled up on this screenshot here. But you can see a map county by county within the region of the projected food insecurity rate for 2020. Again, these numbers lag a little bit. The average food budget shortfall, food insecurity rate among children. There's lots of different data that you can use. And this is incredibly useful as we look to move the needle on these different issues. There's also information on agricultural trends in the park, a food environment atlas. There's data on free lunch eligible children. And you can even see a map of the SNAP and WIC vendors and how much produce availability is at each site. So there's a lot of really great information on the story map. We encourage you all to check it out, to use it in your research, to use it in your partnerships. And thanks again to AHI for the excellent work here. Next slide. All right, wonderful. So this is the final slide for my portion of the presentation. I just wanted to point to all the wonderful steering committee founding members that are part of the network. Of course, AHI as our backbone organization. And we have some organizations that are in the Southern Adirondacks participating in the network, of course. We've got Comfort Food Community. So Josh is going to tell you a lot more about Comfort Foods programs next. We've got Pitney Meadows Community Farm, which is doing some great work with pop-up pantries and a lot of good production and processing. Adirondack Foundation, ANCA, Craig Garden, the Hub on the Hill, Adirondack Council, and Cornell Cooperative Extension, and Adirondack Land Trust. And we have additional members that have joined, but I just wanted to give credit to all of the founding partners, and I hope that I can answer any questions. I don't see any questions in the chat, but that's it for me. My email address is just Brittany@adkaction.org, and I'm going to pop that in the chat as well so that you can email me directly if you want to follow up. And thank you. Oh, I do see there is one, sorry, just quickly. Dylan Hall asked if this is a collective impact initiative. And yes, Dylan, we are using the collective impact framework for this initiative. I was lucky enough to go to a collective impact training that AHI sponsored a couple of years ago. And AHI has brought their collective impact training and expertise to the table for this initiative. So that is our structure.
All right, great. Thank you, Brittany. And that really kind of nicely sets up what I'm going to be talking about. And since, we are talking a lot about health outcomes, we thought we would spend some time talking directly about food insecurity and how that contributes to health, and some of our programs here at Comfort Food Community that we're involved in as a partner in this initiative, but at the same time, working with other various partners in the region, but also really focusing on the Southern Adirondacks for our work. So looking at food insecurity and health, to start off with a backbone of what we mean when we talk about food insecurity and linking that to the food system network is that lack of consistent access to enough food for a healthy and active lifestyle. And that comes in three different ways, and that's really addressed right now in three different aspects of the work we do. One, we see a lot of individuals within the region who are working to promote nutritional benefits through government agencies, whether it be SNAP or WIC or farmers market nutrition programs or Double Up Bucks in New York State. And that really is aimed at addressing the nutritional deficits that a lot of folks see. But at the same time, looking at a lot of the individuals we work with in rural areas and in the Adirondack region, they're often forced to choose between different medical or medicine appointments to pay for food or transportation or rent or utilities in household. So food insecurity itself is linked so much to other choices and other social needs that a lot of our communities are facing. And at the same time, with health-related factors, a lot of chronic illnesses are only exacerbated by poor nutrition, and a lot of comorbidities and a lot of other aspects such as diabetes or hypertension or COPD are complicated by the choice that a lot of our constituents are forced to face. Right, and so just to conceptualize how we're talking about food insecurity and chronic disease, and I'm talking to a lot of health professionals through this conference, and those involved in medical practices, this is something that is becoming more and more apparent. Being able to choose between putting food on your table and your medical expenses is also exacerbated by various different aspects. So the aspects for us and related to the food system network is really providing local, fresh food from the plethora of farms and producers we have within our own backyard. And so our region, so when we talk about the Southern Adirondack region, we're talking about Washington, Warren, and Saratoga counties. Just to conceptualize that area, we're talking about 350,000 to 400,000 individuals within these counties. And on the lower end of actually the food system network overall population of the 9-county region, we're actually seeing a poverty level from 14 to about 15% of these 3 counties related to the overall picture of the Adirondack Park. Again, these numbers are a little outdated. We haven't seen many numbers yet from the effects of COVID in 2020 and also into 2021. And so we face a lot of regional challenges, and Brittany hit on some of them. The reliable transportation and lack of options when it comes to grocery stores. Washington County alone has only 4 grocery stores for a county that's about 30 miles wide and 70 miles long. So, really factoring that in is a huge component to a lot of food choices we make. The geographic distribution, while we're blessed with Adirondack Park, it makes distribution and access to food very difficult. We also have a lot of health disparities within our region. Brittany mentioned the diabetes increase over the last 20 years. 1 in 3 adults and children are struggling with diabetes. 1 in 3 adults struggle with COPD, heart disease, hypertension, asthma, and about 1 in 3 seems to be the common theme, struggle with tobacco addiction or some other form of negative addiction that's impacting primarily their heart or lungs. So when we talk about food insecurity, we also talk about some of the knowledge that underpins it. So recently, over the last few years, there's been a large effort in measuring the food choices of some of our constituents. 1/4 of our population reports eating the minimum servings of fruits and vegetables, which is 5 servings of fruits and vegetables on a daily intake. And about 1/5 of our population reports eating less than 1 serving of fruits and vegetables. And at the same time, there's a considerable amount, between 40 to 60%, depending on the chronic illness that is being exacerbated by food insecurity. So what does that mean for us? So Comfort Food Community is based in Washington County, and we, similar to AdkAction, have really emerged to provide some of that emergency food assistance and food recovery for our local communities, but also work with local farms to make sure some of that local fresh produce ends back up in the hands of people who need it. We also provide resource navigation, so it's more than just food resources, but connecting to our partners in the Glens Falls area, medical providers, health insurance providers, transportation, rental assistance, that all kind of falls under our purview. And lastly, we're really emerging to try some of our pilot programs, our connections with food as medicine programs with Hudson Headwaters to do a food pharmacy and produce prescription program, our farm to libraries program to provide food to those who need it directly in communities through the Southern Adirondack library system. So as I mentioned, engaging partners remains one of the primary aspects of not only our work, but the work of the food system network writ large. Looking at the various intersections between health, transportation, distribution, and access is a significant portion of what we're aiming to address. So it's really flipping that model of food assistance when it comes to Comfort Food Community. It's more than just food. It's community. It's being able to provide that most basic resource from directly in our communities and giving back to our communities. So it's not so much that the farms are directly selling it to grocery stores, or when we have the time to purchase this food and redistribute it to our pantries or other community-based organizations or health connections. It's community driven, and most importantly, it's based on a sense of dignity and bringing down some of that stigmas around emergency assistance and making sure everybody has enough to provide for their families. I just want to point out this one picture here. This was a great opportunity we had with Hudson Headwaters based in Glens Falls to provide their patients who are attending their West Mountain sites with local fresh produce to take home after their doctor's appointment, to take home to their families. So you can see a little bit of what's in it via the sign, but this was a great 2-year program that just ended that really sought to change how we think about food and medicine, and using our connections with Hudson Headwaters to provide their clients and patients with food as well. Just a few, oops, apologies. Here we are. I think I skipped a slide, but I just want to cover a little bit some of the operational frameworks when we're really talking about that food as medicine model and the social determinants of health. So measuring the various components that contribute to someone's well-being, whether it be rental assistance and where you live, to transportation, to employment, these all factor into someone's health and their well-being and the well-beings of their communities. So using food as a platform, this has allowed us to really build upon our communities. And then just wanted to point out, there was a great report that just came out this year, about 2 months ago, from Feeding America, that really looked at the importance of emergency assistance and also the importance between emergency food providers and partnerships across sectors. So the partnership between pantries and health providers can actually address food insecurity more than just one of those acting alone. And that food distribution at clinical settings actually improves access, but there's a lot of gaps that exist between the CBOs dealing with food insecurity and to healthcare providers and vice versa. So how do we really address that? And one of the biggest aspects is that collaboration and partnership across local entities has served such a great, important aspect of what we're doing in the food system network. And we really are seeing that in the food system network, as Brittany showed the slide, with all of the partners coming together, from producers from education to local CBOs, to actually enhance our food system network and provide for our communities. Just a few last thoughts. So as I mentioned time and time again, food insecurity and health intersect quite significantly. The food we eat determines our health and vice versa. And just to put a caveat in there, I'm not saying food should replace any other medicine, but at the same time, food can impact our levels of individuals. This is actually a client who I've worked with for many years, really, who every time I see her and her husband, I get to talk with them about the great strides they're making in improving their health because they're able to access health food at the Glens Falls market and actually through Hudson Headwaters. So, and most importantly, food insecurity programs should go beyond just nutrition, should go beyond just providing that non-perishable food, but really connecting to the local food economy through new purchases of local producers, and really focus on what we can provide those folks, more than just here's a box of food and go with it. And lastly, and importantly, a lot of our partnerships, as we're doing with the food system network, are really driving at this long-term change for our food system while accomplishing short-term goals, but really looking at the long-term effects and how we can deliver more results for our communities across the Adirondack region. So lastly, and we can share, I believe we've shared a few of these, but we can share our information, and this presentation will be on the AHI website, but feel free to reach out to both Brittany or I with any questions you may have after this. But also, I do encourage you all to check out the food system network, as there's quite a bit of data, as Brittany walked through, and that is constantly changing and being updated by AHI and the wonders that they do. But we do have some time, so Sarah, I don't know if you want to take it away with any questions.
Perfect timing. So we did have a question that stated, could AHI please provide a regional map of food outlets to reveal existing food deserts? And Brittany, I know you did provide the map that is on the Adirondack Food System Network page that shows SNAP and WIC. And I don't know, Josh, if you want to actually pop the link up, if that's going to be a concern, to actually show those story maps. If not, don't feel pressured. What I will say, Nancy, I see you're talking about more regular supermarkets. There is another story map on the Adirondack Food System Network page that goes over any type of, and I don't remember the specifics of how he did it, but any type of food source, being stewards, gas stations, grocery stores, farmers markets, I believe. And they're identified in red, yellow, and green to show if they offer the fresh food versus not so much. So obviously gas stations are more likely to be in the red category, whereas green would be grocery stores, farmers markets. It is a good idea though, and it's something we can definitely look into and talk about. I know ARHN, which is the program that I oversee, we just did a healthy food guide as well, in connection with Josh, actually. And the healthy food guide had all of the farmers markets and CSAs in the ARHN region. So my region covers Clinton, Essex, Franklin, Fulton, Hamilton, Warren, and Washington counties. And so we did offer all the farmers markets and CSAs in that area. And we also have a website attached to that, which links over to the Adirondack Food System Network page. It unfortunately does not have supermarkets because we are trying to find those pieces that were not necessarily a Google search away, more of those things harder to find. But it is a good idea to kind of find where you can find those pieces. And what Josh is showing now has the SNAP WIC vendors up. This is what we were talking about with the red, yellow, and green. So it shows, you'll see the farmers market or the grocery stores, Dollar General. And as you scroll through, it'll show you every single store, high, low, and in between. Brittany, Josh, I don't know if you guys want to say anything. That's all I could think of when I saw her message.
Nancy, I would also add that there is a resource called the USDA Food Atlas, and that will show you the food deserts across America. There are some gaps in the data that they use, and it does lag a little bit, but it's the resource for identifying food deserts, especially for accessing funding to address food deserts. So I can put the link to that in the chat as well. But you are right that the SNAP and WIC map does exclude any vendors that don't accept SNAP or WIC. So that's not something we have yet.
Right. We also got a comment from Erica Freudenberger, and she just said, thanks to Comfort Food Community for all their excellent work. They've been tremendous partners in our Farm to Library program, which is a program where they're bringing farm available products to the libraries in our area, which is fantastic. She actually just did a little presentation about it on Friday. So thank you, Erica. If anybody has any other questions, please make sure to put them in the chat. Brittany just popped in that Food Research Atlas link. I will make sure all of these links are in the YouTube description in the recording so that they'll always stay with this as well. Let's see. Any other questions just yet? Brittany or Josh, did you want to add anything, or you want to just sit here and wait for questions?
I would just add to, so related to the red, green, and yellow dot conversation and the story map writ large, and it is something that's evolving, and we're working on where we're going with the food system network, post the story map and how we can change and add to it and make it a resource that's available for everyone.
Yeah. We have another question. Do you work closely with primary care providers to link underserved patients to local/fresh foods? I can open it to both of you, I guess, for that question.
I can speak first, and then I'm sure Josh has more on the Southern Adirondack context specifically. But we have a pharmacy program up here in Essex County as well that's been replicated in Clinton County. And in that case, we have partnered with the health departments for food prescription programs to have those direct referrals from providers to the food source. And those have been great. We've been learning a lot. They're oftentimes paired with nutrition education. So someone that's enrolled in the program will need to speak with their doctor and then get a referral to a nutritionist, complete the nutrition course, and then they get the incentive or the coupon. So I know that there's a lot of different ways that those types of programs work, but that's what we've seen here with our partners.
And for comfort food, yes, the short answer is yes. We do work with Hudson Headwaters. We just actually finished up a 2-year program to our version of the food pharmacy that provided a medically tailored CSA box to individuals. And we worked with the same individuals for a 4 to 6 month period. And they worked with the dietitian and nutrition education. And they were low resource individuals, but also individuals experiencing some form of chronic illness. This last round was primarily focused on diabetics. And so we actually have the measurable clinical data to some extent related to the change in their their A1C levels, their BMI levels, and also some narrative change. And lastly, we also work with CDPHP quite a bit, not as a healthcare provider, but as a healthcare payer, to promote local purchasing at the Glens Falls Farmers Market for individuals, depending on their line of business related to their insurance, whether Medicaid, Medicare, and a few other lines, to provide them with the ability to actually purchase local food through the market there.
Not seeing any other questions yet. Brittany, we had this earlier. We said it's a Monday, so seems everyone's a little quiet on a Monday. But we appreciate it so much that you guys were able to hop on and present to everyone, especially in a platform like the Summit, and get this information out there. I think the Adirondack Food System Network and all of the work that both your organizations and every organization involved does is so important. I've gotten to see it up close with all the work that ARHN has been working on with you guys, but I think it's fantastic. You're getting a lot of woohoos in the chat. And so I think you guys are making a difference. And I really think, I hope at least, that the Adirondack Food System Network takes off, and we have a ton of people involved. I know your work groups are going strong, and I will make sure to, like I said, I'll put all those links in, and I'll put the Google Doc link into the YouTube description as well, so that you can get people connected to that. And then if anybody has any questions, I'll leave it open for another minute or so. And if not, I guess we'll end early, if that works for you guys. This was great. Thank you so much.
Thank you, Sarah. Thanks, everyone.
Thanks, everyone.
Well, we have some airspace. I'll just share my biggest insight into the barriers to getting people involved in local food systems and getting consumers to try local food is it's all about mitigating risk. And so what I've learned is that eating local food can feel more risky than eating packaged food, because every single beet or every single carrot is going to be a little bit different. The sweetness changes throughout the season, the size and the texture changes throughout the season. Even one farmer at the market to the next, it's going to be a slight change. And so we find that a lot of the consumers we work with are scared of taking on that risk. You know, what if my family doesn't like this new thing that we haven't tried before? Or what if this week the carrots are a little bit mealy, that sort of thing. And so when you think about it from a perspective of having limited resources, using those limited resources on something where you're not exactly sure what to expect and you have to be able to field some variability, it makes sense that there's sometimes hesitance. And when you add an increased price point, it makes it even harder. And so for that reason, I think it's really important for us to consider all the ways that we can possibly support consumers with education, with subsidies, with increased access, because it's not a simple or trivial thing to ask a family to change their eating behaviors or to eat locally. So anyway, risk, that's my takeaway from doing this work.
Yeah, that was great. I've never thought of it that way, but it's very true. Okay, well, I think we'll go ahead and end early. I don't see anything else coming in. Brittany did put her email in the chat earlier, and Josh had it on the slide, and it will be in there. And actually, Nancy just popped in another question. How are the aged being approached as they are less interested in eating and have few/no social eating opportunities?
Josh, do you want to take that one?
Yeah, absolutely. So, we have a few different ways we're doing this, and we're really relying a lot on our partnerships to kind of address how we can deal with our seniors. We have a few different opportunities throughout the region. In the summer months, we do our best to provide local options to senior living facilities throughout the Glens Falls area and Washington County as well, actually bringing the food to them. We actually will be piloting this coming winter also a supplemental CSA box for seniors as well, as a way to engage them in local food as well. So, and I mean, there's considerable difficulty too with a lot of our seniors I always give the butternut squash example of that. It's great to give butternut squash out, but at the same time, for a senior living in a senior living facility who can't necessarily process that squash, maybe can't use a huge squash like that, how can we make it more usable and readily available, and that takes down some of that vulnerability about using local produce. So one of our biggest things that we try to do is bring the food directly to those individuals. And at the Glens Falls Market, we really focused this year on improving access to Medicare individuals through CDPHP. So we're looking to broaden that across the board. And we are, working with Hudson Headwaters to really help some of their more homebound individuals that way.
Nice. I love to hear all the good work. It makes me so happy. All right, well, I will go ahead and end. If you guys need anything, please reach out to Josh and Brittany. Their emails are on the slides as well, and they will be archived by October 1st. So the recording and slides will be up there. And if you have any questions, even from then till now, or from now till then, email ahisummit@ahihealth.org, and I'll make sure that we connect you right over to them. So thank you so much for attending. Brittany, Josh, thank you so much for your presentation, and we will see everyone at 2 o'clock for the next session.
Thanks so much. Bye, everyone.
Thank you all.